Hey everyone, welcome back to our Neurology series. In this module, we are going to study about seizures and epilepsy. Before beginning with the video, I would like to let all of you know that we have now collaborated with UWorld Medical. You can get a flat 10% off on their medical library and bundled QBank and medical library subscriptions using my code Varun10. So this medical library is a highly organized study resource that is integrated with every UWorld QBank, and they have powered it with an AI-powered tool called UAsk, where you can ask anything from their medical library. You can learn faster with an integrated all-in-one content, and you can eliminate resource switching, so save time and stay in flow. You can explore the medical library with the link that is in the bio, and you can get a flat 10% off using my code VARUM10. You can get 10% off on their medical library subscriptions and bundle QBank and medical library packages. This lecture series is provided free and is open access for everyone. There are no paywalls or mandatory fee. If you find it useful and wish to support its continued development, you can contribute to us voluntarily with the link that is on the screen and that's also pinned in the bio. You can also contribute to us on PayPal for any audience from outside India. You can contribute to our free educational cause using this PayPal QR code. Now, let's begin with trying to understand about what a seizure is. So first of all, in this video, we'll discuss one of the most high-yield topics in neurology, like seizures and epilepsy. We'll learn how seizures are classified, understand the clinical features of different types of seizures, and recognize important epilepsy syndromes, and finally review the major anticonvulsant medications that are frequently tested on the USMLE and EPG. So first of all, let's try to understand about what a seizure is. So a seizure is a sudden transient episode which is caused by abnormal, excessive, synchronized electrical activity of neurons within the brain. So a seizure is an abnormal neuronal firing. The symptoms depend on which area of the brain is involved. So for suppose a seizure is an event, whereas epilepsy is a chronic neurological disorder in which a patient experiences recurrent unprovoked seizures. So this distinction between seizures and epilepsy is extremely important because not every seizure means that the patient has epilepsy. And epilepsy is a chronic neurological disorder in which a patient experiences recurrent unprovoked seizures. You can read about this epilepsy and seizures on UWorld Medical Library. So it's organized into different subsections like introduction, pathophysiology, risk factors, clinical presentation, diagnostic evaluation, diagnosis of epilepsy, differential diagnosis, and management of status epilepticus. So this is a highly organized study resource that is easy to read and understand. You can use my code Varun10 to get a flat 10% off on their bundle QBank and medical library subscriptions and also standalone medical library subscriptions. Now, coming to the classification of seizures. So the first step in approaching any seizure question is to determine whether the seizure is focal or generalized. Focal seizures begin in a localized region of one cerebral hemisphere, whereas generalized seizures involve both the cerebral hemispheres simultaneously from the onset. So once you've identified the seizure type, so choosing the diagnosis and treatment becomes much easier when you're able to differentiate them, whether it's a focal or a generalized seizure. Always, you need to identify the type of seizure first. Focal seizures originate from one localized area of the brain, most commonly the temporal lobe. They're divided into two main categories. So, in focal aware seizures, consciousness remains intact. Its consciousness is completely preserved throughout the event, whereas in focal impaired awareness seizures, consciousness becomes impaired and the patient may appear confused or unresponsive during the episode. One of the classic features of focal impaired awareness seizures is the presence of automatisms. So these automatisms are nothing but repetitive involuntary movements that serve no kind of purpose. Common examples of these focal features includes lip smacking, chewing movements, repetitive hand movements, repetitive swallowing, or so hand movements that are automatic. So automatisms are nothing but repetitive involuntary movements or behaviors that occur during focal seizures and they serve no kind of purpose. Examples of these automatisms includes lip smacking, chewing movements, hand movements, and repetitive swallowing. In generalized seizures, abnormal electrical activity involves both the cerebral hemispheres simultaneously. So, because both the hemispheres are affected from the beginning, patients usually do not experience an aura. Generalized seizures include absent seizures, myoclonic seizures, tonic-clonic seizures, and atonic seizures. Absent seizures are characterized by brief staring spells, usually lasting for less than 10 seconds, whereas myoclonic seizures are characterized by sudden brief muscle jerks. Tonic-clonic seizures are characterized by stiffening followed by rhythmic jerking, whereas atonic seizures are characterized by sudden loss of muscle tone, which leads to recurrent falls or drop attacks. Absent seizures usually occur in children. They usually present as sudden episodes of blank staring lasting for less than 10 seconds. The child abruptly stops when whatever they are doing and then immediately resumes normal activity afterwards after that 10-second period. Importantly, there is no post-ictal confusion. The classic electroencephalogram finding is a generalized 3 Hz spike and wave pattern. Myoclonic seizures consist of sudden, brief, and shock-like muscle jerks. Consciousness is usually preserved. There is no loss of consciousness, and the patients usually recover immediately without any kind of post-ictal confusion. They return to the baseline immediately. So these myoclonic seizures commonly occur shortly after awakening and are characteristic of juvenile myoclonic epilepsy. Tonic-clonic seizures begin with tonic phase, which is like stiffening, during which all the muscles become rigid because of sustained muscle contraction. This is followed by clonic phase, which is characterized by rhythmic jerking of the limbs. So patients commonly bite their tongue, lose bladder control, and develop prolonged confusion after the seizure, which is known as a post-ictal state, and this is characterized by fatigue, drowsiness, and disorientation. Atonic seizures are caused by a sudden loss of muscle tone because muscle support disappears abruptly. Patients collapse to the ground without any kind of warning. They're often called as drop attacks. The greatest concern in these patients is traumatic injury from repeated falls. In atonic seizures, there is loss of muscle tone, which leads to sudden loss of postural muscle tone, and this eventually presents with drop attacks, sudden falls without any kind of warning, and there's a risk of injury whenever there is drop attack. High risk of head trauma and other injuries are a possibility. A seizure typically progresses through 3 phases. So the aura is the earliest warning symptom, whereas the ictal phase is the period of active seizure activity. Finally, the post-ictal phase represents the recovery period after the seizure has ended. Aura is usually characterized by subjective symptoms. This may include unusual sensations, smells, visual changes, and deja vu. Duration of this is for about seconds to minutes, whereas ictal state is usually uh, characterized by clinical seizure occurrence. There's abnormal electrical activity in the brain, and the duration of this is for seconds to a few minutes. Post-ictal state is characterized by gradual recovery. There is confusion, drowsiness, headache, and fatigue. Duration of this could be around for minutes to hours. So the classic sequence of phases of seizures is firstly aura, which is a prodrome, then followed by seizure activity during the ictal phase and recovery during the post-ictal phase. And this post-ictal phase is associated with confusion, drowsiness, headache, and fatigue. An aura represents the earliest manifestation of a focal seizure. Depending on the cortical region involved, patients may experience a rising sensation in the abdomen, unusual smells that are not actually present, or a feeling of deja vu. So, what's this deja vu? So, deja vu is nothing but a state of, the strange feeling when that you have experienced what is happening now. So, deja vu is characterized by a feeling that whatever you're experiencing right now, you would be feeling that you had experienced it beforehand. So that's called as deja vu, and deja vu is a common presentation in cases of aura, and aura represents the earliest manifestation of a focal seizure. Depending on the cortical region involved, patients may experience a rising sensation in the abdomen. So this could be epigastric rising, unusual smells that are not present, hallucinations of smell, and deja vu. These symptoms occur before consciousness becomes impaired. The ictal phase begins when abnormal electrical activity starts and continues until the seizure terminates. This is the period during which the characteristic motor, sensory, autonomic, or behavioral manifestations of the seizure occur. Following a seizure, patients enter the post-ictal phase. So during this recovery period, they commonly experience confusion, headache, fatigue, and excessive sleepiness. Some patients also develop thought paralysis, which is a temporary weakness affecting one side of the body that usually resolves over several hours. So thought paralysis is nothing but transient weakness or paralysis after a seizure that usually occurs on one side of the body, usually presenting after a seizure. Childhood absence epilepsy presents with frequent absence seizures in otherwise healthy children. This condition usually improves by adolescence. The first line treatment of this childhood absence seizure syndrome is with ethosuximide, which blocks the T-type calcium channels within the thalamus. Juvenile myoclonic epilepsy syndrome usually begins during adolescence. The hallmark finding is sudden bilateral arm jerks occurring shortly after awakening. Patients may also experience absent seizures and generalized tonic-clonic seizures, making this a mixed seizure disorder. This is seen in teenagers, usually characterized by morning jerks, and there are mixed seizure types like myoclonic, generalized tonic-clonic, and absent seizures. Eclampsia refers to new onset generalized tonic-clonic seizures occurring in a pregnant woman with preeclampsia. It usually develops after 20 weeks of pregnancy or shortly after delivery. The treatment of choice is intravenous magnesium sulfate. So eclampsia is nothing but new onset seizures in a pregnant woman with hypertension or proteinuria. Febrile seizures occur in children during 6 months and between 6 months and 5 years of age during episodes of fever. They are benign, self-limiting, and do not increase the long-term risk of epilepsy. Treatment usually focuses on supportive care and fever control rather than anticonvulsive therapy. PNES or psychogenic neuroepileptic seizures usually resemble epileptic seizures clinically, but they're not caused by abnormal electrical activity in the brain. There's normal EEG. Clues include prolonged duration, asynchronous movements, preserved awareness during generalized movements, and a normal electroencephalogram during the episode. These events are often associated with psychological stress or psychiatric disorders, and this PNES, psychogenic non-epileptic seizures, is usually characterized by normal EEG. The choice of anticonvulsant depends primarily on the type of seizures. So, some drugs are effective only for focal seizures, whereas others have broad spectrum activity and help treating multiple seizure types. So, understanding each drug's mechanism of action makes remembering their clinical uses very much easier. So, there could be three different mechanisms in most of the anticonvulsant drugs. So, one of those could be by inhibiting the sodium channel or enhancing GABA activity, potentiating GABA A receptors, and also suppressing the excitatory neurotransmission. Phenytoin blocks voltage-gated sodium channels, stabilizing the neuronal membranes and reducing repetitive firing. Major adverse effects include gingival hyperplasia, excessive hair growth known as hirsutism, and Stevens-Johnson syndrome. So, so it is also a potent cytochrome P450 enzyme inducer. So it's highly teratogenic. So whenever a drug is inhibiting the cytochrome P450, you need to understand that there could be reduced activity of the drugs that are metabolized by this cytochrome P450. This usually acts by inhibiting the sodium channel, thereby stabilizing neuronal membranes and reducing repetitive neuronal firing. Carbamazepine also blocks voltage-gated sodium channels. Important adverse effects includes syndrome of inappropriate antidiuretic hormone secretion, causing hyponatremia as well as agranulocytosis and aplastic anemia. So, like phenytoin, it is a strong cytochrome P450 inducer. So, side effects of this carbamazepine usage include syndrome of inappropriate antidiuretic hormone secretion, agranulocytosis, aplastic anemia. So, the patients whoever are started on carbamazepine, they need to be monitored with a CBC because there's a high risk of aplastic anemia. Clinical uses of carbamazepine are in focal seizures, generalized tonic-clonic seizures, trigeminal neuralgia, and bipolar disorder. Gabapentin binds to alpha-2 delta subunit of voltage-gated calcium channels, decreasing neurotransmitter release. Common adverse effects include sedation, dizziness, and peripheral edema, whereas ethosuximide is usually characterized. Ethosuximide is the drug of choice for childhood absence seizures. Its mechanism of action is selective blockage of T-type calcium channels within the thalamic neurons, interrupting the 3 Hz spike and wave activity, which is characteristic of the absence epilepsy. Valproic acid is a broad spectrum anticonvulsant which is effective for both focal and generalized seizures. It blocks sodium channels, inhibits T type calcium channels, and also increases the GABA levels within the brain. So, major adverse effects of valproic acid includes hepatotoxicity. So, we need to monitor LFTs regularly. The other adverse effects includes pancreatitis and severe teratogenicity, particularly neural tube defects. It's highly teratogenic. There is a risk of neural tube defects, cognitive impairment, and facial dysmorphism. So we need to avoid valproic acid in pregnancy if possible. So this is contraindicated in cases of pregnancy, liver disease, and urea cycle disorders. This valproic acid acts by increasing the GABA levels, reducing sodium channel activity, and also blocks the T-type calcium channels. Lamotrigine primarily blocks voltage-gated sodium channels. The most important adverse effect of lamotrigine is Stevens-Johnson syndrome. For this reason, the medication must always be started slowly and discontinued immediately whenever, if there's a possibility of rash developing. In case of usage with lamotrigine, immediately it should be stopped. Levetiracetam binds to synaptic vesicle protein SP2A, reducing the neurotransmitter release. It is generally well tolerated but may produce behavioral adverse effects such as irritability and psychosis, depression, and agitation. Psychosis is usually characterized by hallucinations and behavioral changes. So this levetiracetam is used as an adjunctive therapy for partial onset seizures, myoclonic seizures, and primarily generalized tonic-clonic seizures. Topiramate has multiple mechanisms of action. It blocks sodium channels, enhances GABA activity, and also weakly inhibits the carbonic anhydrase. So important adverse effects of this topiramate could include cognitive slowing, paresthesia, weight loss, and calcium phosphate kidney stones. So the mechanism of action of topiramate is usually associated with multiple mechanisms. It acts as a sodium channel blocker, T-type calcium channel blocker. It enhances GABA activity, potentiates GABA A receptor, and also antagonizes AMPA or kainate glutamate receptors. Also, alongside, it also weakly inhibits carbonic anhydrase. So all these mechanisms help us help with the usage of topiramate to prevent uh, partial seizures, generalized tonic-clonic seizures, and also this is also used in migraine prophylaxis because of its sodium channel blocker activity. Common side effects includes cognitive slowing and calcium phosphate kidney stones. This can also aid in weight loss. So this could be used in weight loss. For this could be indicated for weight loss. So now let's just try to quickly summarize whatever we have learned in this module. So a quick way to remember treatment is for focal seizures, first of all, think of phenytoin and carbamazepine. For absent seizures, think of ethosuximide. So ethosuximide is used for chronic prophylaxis of absent seizures in children. For generalized seizures, think of valproic acid because of its broad spectrum activity. Focal seizures begin in one hemisphere. Absent seizures show a 3 Hz spike and wave pattern on EEG. Myoclonic seizures produce sudden muscle jocks. Tonic-clonic seizures have a prolonged post-ictal phase. Valproic acid is the classic broad-spectrum anticonvulsant. This is effective in focal, generalized, tonic-clonic, myoclonic, and absence seizures. Ethosuximide is the drug of choice for childhood absence seizures. So whenever you see a 3 Hz spike in wave pattern on EEG, start patient with ethosuximide immediately. This is the end of our module on seizures and epilepsy. In the next module, we're going to discuss about spinal cord disorders. I'll be right back with another video. Till then, subscribe and keep supporting. Thank you so much. Bye.